feel it? My back, yeah.
Just in her back, though.
Okay.
It's okay to feel it in her back.
I feel it in my thigh.
Okay, so it's turned down. You feel something in your thigh?
Yeah, it's gone.
It's gone? Okay. Alright, so then click stop. Now go to motor. Alright, so we're going to start motor. So Raphael, you're going to put your hand on your hand in the left calf as you're turning up. Luckily he has a long arm. But I could also like put my, I can put my like elbow on it, you don't have to do. That's good. And I'm just feeling for contractions. You go up to 2 again. I don't feel anything. Alright.
Also my thigh.
You feel something?
In my thigh.
Moving or just
cramping? It's like a throbbing.
It's cramping?
It's like a throbbing. Like a...
Okay, so let me move this back. Is it gone now?
Yeah, now it's about that.
Okay, good. Alright, let's stop. So it could have just been slightly irritating, so that's why if you withdraw it just to make sure it's not too close to the nerve. Okay. So yeah, we're gonna start now. So it's gonna be set at 90. No, it's 10. Yeah. Okay. So we're gonna click start. Okay. Alright, so it goes staggered by 15 seconds. So this part is where, we're doing the actual RF, okay? And that's pretty much it. Like we do this for 90 seconds, we turn it, we do another 90 seconds because the tip of the probe generates an elliptical lesion, so if you turn it 90 degrees, you can get a full circle and get a more higher chance of getting rid of the pain nerve. And it takes up to 4 weeks to work, and then it lasts for 6 to 12 months. Alright, so she's fully awake, just numbing medication, and it's pretty comfortable. It's not intolerable. This is good for anybody with chronic lower back pain due to osteoarthritis of the facet joints, which is usually pain worse with standing or bending backwards, or pain when getting up from a chair that's not nerve pain, that doesn't necessarily radiate all the way down the leg like a sciatica pain. It's also great for people who've experienced trauma and have post-traumatic arthritis, which would be car accident patients, fall victims, things of that nature, or chronic wear and tear. If you're a weightlifter, somebody who's had a strenuous job, sometimes this accelerates arthritis as well. And sometimes that pain is experienced as a bit of a radiation into the thigh or buttock, but it's usually not electricity-like pain. We always do a test before we do this procedure, which is called a medial branch block, and it's just a temporary nerve block with numbing medication. Very few side effects for just the test procedure. It's really a pretty safe procedure in the office with x-ray guidance.
We can rotate it.
Yeah, we're all done, so we're just going to rotate 90 degrees. Very exciting thing to see the rotation, but instead of surgery, or when surgery is not indicated or not safe due to medical conditions, the one thing that patients need to do is stop any blood thinners for a number of days depending on what they're taking and get that cleared with their cardiologist if they have a condition. There's no steroids given, so it doesn't affect blood sugar. It really just would need to be somebody whose blood pressure is stable and is not currently on blood thinners. So those are